Dr. Anna Chagas. I'm the low vision optometrist at the Lighthouse Low Vision Clinic.
Well, thank you for joining us today. Since you are our in-house expert, we have a number of questions we would like to ask you today so that we can better educate the public about various different eye conditions. So the first one we're interested in hearing about your expertise is the Leber congenital, and then how do you pronounce the last word?
Amaurosis. Leber congenital amaurosis, or LCA.
Right. So could you describe to us how someone is diagnosed with LCA?
Yeah, so LCA, it is a type of inherited retinal dystrophy. It manifests itself in the first 6 months of life with significant vision loss. Patients can be diagnosed with LCA with the help of a thorough eye exam from an eye care provider. During the exam, the retina is assessed, although initially patients who have Leber congenital amaurosis may have a relatively normal looking retina, and the degeneration of the retina occurs later in life. During the assessment, the provider also looks for other signs, things like nystagmus, which is an involuntary or roving eye movement that can occur. Often, kids with LCA they experience light sensitivity. The exam alone is actually often not enough to diagnose LCA. A special test called an ERG, or electroretinogram, is needed to give the diagnosis of LCA, as well as family history and genetic testing that are helpful for that diagnosis.
So what are some of the warning signs that people should be aware of? You did list off some of them. Is there anything else?
Yeah, so vision loss is primarily one of them. You know, it's hard to see a sign of vision loss in kiddos. They can't tell us when they're babies. But some things that parents can watch for is, if the child is not following objects with their eyes, if they're unable to fix their gaze on objects, then we worry about vision loss. We talked a little bit about the involuntary eye movement, or nystagmus, as well as, if they are sensitive to light, that can be a sign. As well as some children, they sometimes feel like they need to poke themselves with the finger or rub their eyes, and that is a way to try to stimulate their eye. So if parents are noticing those things, those are signs for them to get in and get their eyes checked.
Okay. So is LCA a progressive eye disease?
It is a progressive eye disease. The visual acuity in children with LCA differs significantly among patients with different gene mutations. So depending on what is causing the LCA, which gene, where the mutation is located, it will present differently. So some kiddos are born having some vision, and some with no light perception. So there's a bit of variation depending on the differing gene mutations.
So how long does it typically take for the progression of the disease?
Everybody is different. Yeah.
Okay.
There's a particular one, and I'll touch upon it a little bit more when we talk about some of the new gene therapy and things like that. There's a particular abnormal gene called RPE65. And with that condition, the vision loss happens a little bit later than kind of the typical LCA that we notice.
So is there primarily what group of people? Is there a group of people that primarily get LCA more readily than other groups of people, or?
It is an inherited in an autosomal recessive manner, which means that both parents have to carry the defective gene for the condition to be passed on to their child, but there's no, it's not prominent in certain populations.
Okay. So in working with patients with LCA, in what sorts of ways does it start to affect their lives? daily tasks, relationships, that type of thing.
Yeah,
Work.
it affects all aspects of the patient's lives, as well as the parents. Kind of figuring out the steps, resources, kind of what to look out for. And children with LCA, they tend to begin learning adaptive techniques early on in life, which can help them really thrive as they grow up.
Hmm. So is this a disease that's typically onset when people are younger, or can they be older?
Usually when they're younger, so within the
Okay.
first 6 months of life.
Okay, so that's why you keep referring to children in
Hmm.
this discussion. Okay, okay.
Hmm.
So when someone comes in with an LCA diagnosis, what can they expect in their appointment at the low vision
Hmm.
clinic with you?
Yeah, so they can expect a complete functional vision assessment. So figuring out how are they using their vision and how to enhance and optimize the vision that they have, as well as we often will evaluate what adaptive techniques and devices are helpful to them. And a big part of what we do, especially when we see kids in the clinic, is connecting the patients and the family members to resources. So national resources as well as local resources, connecting to them to the resources in their schools as well. So that's kind of a big part of what we do in the clinic.
Okay. How common is this LCA?
It's actually a rare genetic eye disorder. The prevalence of LCA has been estimated 1 to 2 in 100,000 births.
Wow.
This disorder, it affects males and females equally. It does account for about 20% of legal blindness in children.
Okay. So is there any new research related to LCA that you're aware of? Any advances
Mhm.
coming down the line?
There's definitely treatments that are in the pipeline. In 2017, the FDA did approve Spark Therapeutics to use a gene therapy called Luxturna. And that was for that particular gene that we talked about, and that was the RPE65, the one that affects people later on in their life.
Okay. Is there anything else that somebody that they should know about this particular condition, especially if it runs in their family and they're thinking of having children or have someone in their family?
Yeah, genetic testing helps with attaining an accurate diagnosis, which is also important for the patient and the family members in learning more about the emerging treatments, clinical trials. So, really helping patients and their family members stay on top of it.
Okay. Is there anything that I have forgotten to ask you?
No, that was great.